Hello everyone, this is Dr. Namrata Agrawal, a critical care specialist at Borivali Healthcare. And today I want to explain something very important that many families notice in the ICU but often feel unsure about. And that is why we doctors and nurses encourage early mobilization, which means simple movements like sitting up in the bed, dangling the legs, moving the arms and legs, or even standing and taking a few steps with support. When someone is critically ill, the body goes through enormous stress. Muscles begin to weaken very quickly, sometimes within just a few days of lying in the bed. That is what we call as disuse atrophy. This weakness does not only affect the arms and legs, but also the breathing muscles, making it harder for patients to breathe on their own or come off the ventilator. Prolonged bed rest can also slow down blood circulation, increases the risk of blood clots, which causes swelling in the legs, weakens the bone, and even affect mental alertness and mood. That is why early mobilization is such an important part of the ICU and which is not taken care of in most of the places. As soon as the patient becomes medically stable, even if they are still very weak, we encourage small, gentle movements. Sometimes these movements can be passive, sometimes these movements can be active also. This may start with simply changing positions in the bed, sitting up with support, or dangling the legs over the side of the bed. Gradually, as strength improves, the patient may sit in the chair, stand with help, or take a few steps under supervision. This may look like very small efforts, but they are very powerful and they have very good effects on their recovery. Early movements help expand the lungs, clear secretions, improve oxygen level, and reduce the chances of pneumonia. It improves blood circulation, which lowers the risk of blood clots and bed sores. It helps the joint become flexible, prevents muscle loss, and helps patient regain independence faster. Movement also keeps the brain active, reducing the chances of confusion and delirium, which is very common in any ICU patient. Studies have shown that patients who started early mobilization often recover faster, spend fewer days on ventilators, have shorter ICU stay, and face fewer long-term complications. Families sometimes worry that moving the patient will cause pain, exhaustion, or worsening of their condition. But all mobilization in the ICU is done very carefully under supervision. Nurses, physiotherapists, doctors work together, constantly monitoring vital signs like blood pressure, heart rate, oxygen levels, and breathing. Movements are stopped immediately if the patient feels uncomfortable or tired. Gentle movements does not harm the patient. In fact, it strengthens the body and supports healing. Early mobilization is one of the most effective and natural therapies we use in the ICU, and it plays a major role in helping patients return to normal life after critical illnesses. So when you see your loved one being encouraged to sit up or move, remember that each small step is a big step towards recovery, and you need to encourage them to do that as well. If this explanation helped clear your doubts or reassured you, please like this video, subscribe to the channel for more simple, trustworthy medical guidance, and share it with anyone who is recovering from an ICU. Recovery is truly a team effort, and every small moment counts. Thank you.